What are you seeing in practice right now in terms of, aging populations? Any health concerns?
Well, currently the trend is to do so much more at the primary care level. It's getting more and more challenging to try to get patients to subspecialists, to send them to, say, a neurologist, to send them to an ophthalmologist, even. And any of these specialties, it takes a very long time to get a patient in, and it's very challenging to get the patient to go. Most of these elderly patients are not comfortable going outside. So if I tell them go get a hearing test, for example, they may not do it. So that's the challenge. And now, especially with Medicare Advantage plans, it's very confusing for the elderly patients to navigate through these Advantage plans. We have to go through referral processes, authorizations, and they just don't seem to understand how to do it. And it frustrates them. It frustrates us as providers to really get them the proper care.
Hey, it's confusing for me. It's confusing for anybody to figure out the pathway on where we're supposed to go for our healthcare these days, right?
Yeah.
And then it is cumbersome to have to be referred out to all these specialties. Daniel, what about you? What are you seeing as trends in this whole arena in healthcare in the aging population?
Just patients wanting to stay healthier for longer. It's we believe that healthy aging is linked to an active lifestyle. Obviously, healthy habits, exercise, proper diet, nutrition, and everything are lifestyle adjustments these patients can make. And I can absolutely agree with and relate to everything Dr. Hamaway just said about if she's trying to refer out for audiology, we see it on our end. Patients don't often follow through with those referrals because, it's just easy to keep living in a quiet world when you've got mild to moderate hearing loss because it's all you know. But the idea here is among the comorbidities associated with hearing loss, to us, the two scariest are cognitive decline and depression. I've already touched on the cognitive decline aspect, but in terms of depression, patients with hearing loss that struggle to hear in noisier environments or group settings, multiple speakers, we see it every day. They begin to socially isolate. They don't go to their group settings, to the restaurants, to church, or wherever they go to socialize and interact with other people. And as a result, they socially isolate, which is going to potentially lead to depression and overall decline. So that's just another reason we want to detect and treat hearing loss as early in its development as possible and make it convenient and under the roof of their primary care physician.